Hello, I'm Steve LaCroix and I'm the Clinical Manager for EMS Products at Mercury Medical. As a 30-plus year paramedic and respiratory therapist, I've seen many changes in medicine, none more exciting than the increased use of continuous positive airway pressure, or CPAP. Before introducing FlowSafe 2 and FlowSafe 2 Easy, it's important to take the bigger view and look at the indications and contraindications of CPAP. CPAP should be a treatment consideration for any patient in respiratory distress. The most common indications would include congestive heart failure, pulmonary edema, asthma, COPD, chest trauma, and near drowning. As important as indications are, contraindications are just as important, if not more important. Most of these patients are acutely ill and need immediate treatment other than CPAP. CPAP would only delay the appropriate treatment, so contraindications include cardiac arrest, injuries to the face that prevent a good seal, pneumothorax, respiratory failure, unstable airway, severe altered mental status, and recent gastric surgery, excessive secretions, and cardiac instability, excessive nausea and vomiting. However, we have to look at cardiac instability should be considered a relative contraindication since CPAP is used for congestive heart failure patients. The important point here is that CPAP can reduce cardiac output, causing the patient's blood pressure to fall. Altered mental status could include hypoxic patients, drug overdose, or failure to follow directions for whatever reason. We also have to be concerned with any patient that is at risk of aspiration. They may have just eaten. In addition, a patient must have a patent airway and reasonable respiratory effort to be a candidate for CPAP. CPAP is not a ventilator, and those patients need such mechanical ventilation or airway control are not candidates for CPAP. The patient has to be able to move air on their own. The three main things to remember when applying CPAP is coaching, proper fit, proper flow rates. A failure of any component will spell disaster for the therapy. The biggest variable in the effectiveness of CPAP is in total control of the clinician, is hands-on, and coaching of the patient or a good bedside manner, an art lost on many clinicians. When applying CPAP, probably the worst technique is to strap the device on someone's face without some explanation or coaching. I've seen clinicians start the process out by saying to patients, "You're not going to like this," or just start strapping the device on. In either case, it's a bad way to start. Remember that patients are CPAP candidates are in distress, not in failure, so you have some time to set up and explain the procedure. Most patients like to be in charge, or at least feel like they have some say in what's going on. With the deluxe mask, I find it's best to pull the head harness back over the mask, allowing the patient to hold the mask to their face without the harness on. This is when coaching is at its premium. Keep a hand on the mask, allowing the patient's hand, and allow them to pull the mask away in the beginning and slowly use your hand to hold the mask in place. Once they allow you to keep the mask on, pull the harness over their head and tighten the Velcro. Another issue having to do with patient compliance is proper mask fit. And most devices come with several types and/or size of mask, generally large, medium, and small. The bottom line is, if the mask is not comfortable and does not seal, then CPAP just won't work. The deluxe mask has a double seal and requires very little pressure to get a seal. The head harness is easy to apply, adjust, and doesn't pull the patient's hair, and the forehead support takes the pressure off the nose, which is the most common complaint. Flow rate is the key for many patients. I have seen some clinicians want to sedate patients who are fighting the ventilator or CPAP device when all they need is the flow of the air increase to meet their demand. All of us will experience air hunger if we don't get the air we need. So think flow before sedation. It's important to realize you are the unknown variable in the effectiveness of CPAP, and for patient compliance, you need the right flow, the right pressure, a comfortable mask, and a clinician that knows how to coach. Today we are introducing the next generation of FlowSafe, the FlowSafe 2. The original FlowSafe is shown to be very effective. However, FlowSafe 2 has some improvements that came from feedback from clinicians like you. Like the original FlowSafe, FlowSafe 2 uses no capital equipment and connects directly to a standard flow meter or regulator on the low pressure side. There is also a built-in manometer to regulate the pressure. Anytime a patient is on CPAP, a pressure manometer should be mandatory to accurately provide pressure and to be able to document what pressure the patient received which could be critical from a legal standpoint. Without a manometer, how do you accurately titrate the pressure being provided to the patient? Well, the answer is simple. You can't. FlowSafe 2 is an open-circuit CPAP device, so anything that may block the end could cause an increase in pressure. The pressure pop-off valve will prevent the pressure from harming the patient. As you can see, one of the changes from the FlowSafe to the FlowSafe 2 is the blue cap at the end, making this almost impossible by blocking the end. FlowSafe 2 has the option of 3 different types of mask. First is the cushion mask with the blue head strap. The head strap attaches to the mask using the attachment ring on the mask. The next mask is the intermediate cushion mask with a head harness, and finally the deluxe mask that has the head harness and forehead support, as you can see here. With the success in patient care with FlowSafe 2 and listening to feedback from clinicians, Mercury Medical has developed a third-generation CPAP device called the FlowSafe 2 Easy. The FlowSafe 2 Easy comes with the same advantages of FlowSafe 2, with the built-in manometer, pressure pop-off, deluxe mask, and reduced oxygen consumption. The big difference is the integrated nebulizer and a valve that allows the nebulizer and the CPAP device to be powered by one oxygen source. This gives the clinician the option of CPAP or CPAP in a nebulizer with the turn of a switch. It's important to know that when both devices are being used, the device will consume more oxygen to power the nebulizer and maintain the pressure needed. The inline manometer makes the adjustment easy. Many providers have found that this simple trade-off works well in their system. Our goal with the FlowSafe family of devices is to provide a solution that may be unique to your system. If you have any questions, please contact Mercury Medical at 1-800-237-6418, or by all means, go to our website at www.mercurymed.com.